Mold is more of a big deal than you realize. And if you're one of those people out there who are maybe saying there's no such thing as mold illness, guess what? This episode is not for you. But for those of you who are suffering from a lot of weird symptoms, maybe symptoms you can't figure out, this is a possibility that you should consider. Toxic mold and mold-related illness is more common than you think. And when I was only practicing conventional medicine, I thought anyone who talked about mold was absolutely crazy. But it turns out that I was devastatingly wrong. Mold exposure can cause so many health issues that are just dismissed. It can cause hormonal imbalances, brain fog, headache, asthma, fatigue, insomnia, hair loss, autoimmunity issues, balance issues, weird sensations I'm going to go into. And it all starts with just feeling like something is off. What do I mean when I say mold-related illness or mold toxicity? First of all, I mean illnesses, and I'm going to give you some symptoms in a moment, that result from the toxins found in mold. Now, this is not the same as mold allergies. You could be allergic to mold, which means that you could sneeze, have a runny nose, but that's not the same as being sick from the toxin in the mold. Those symptoms are completely different, and I'm going to go over them in a moment. But some of you might say, but there's mold everywhere. Mold is found in nature. Are you telling me that everyone is sick? And the answer is yes and no. Here's what I mean. Let's start with the yes. Mold-related illness is so prevalent and is so misdiagnosed or not diagnosed. There's so many more people that you can even imagine are actually sick from it. Many of you are listening who are dealing with various aches and pains and weird sensations, fatigue, anxiety, depression. You've maybe been on a journey for a really long time. You might be dealing with mold. So yes, many more people than we're actually imagining are actually dealing with mold problems, probably in the millions. But also no. And no, because just because you're exposed to mold doesn't mean you have mold-related illness. In fact, most people who are exposed to mold feel just fine. And that's because not everyone has a problem detoxing the mold out of their system. Most people can be exposed to mold and be just fine, which is why it gets really tricky. Let me explain. When most people are around mold, their bodies have a natural defense system. So the immune system recognizes the mold and tries to get rid of it. The lungs create mucus to trap and expel it. The liver and the kidneys do their job and they metabolize and detoxify mold toxins. And it comes out in urine, feces, sweat. So for most people, being around mold doesn't cause any problems. The body just eliminates it and you don't even know that you're exposed and the body just clears it out. But for some people, and probably many of you listening, and the reason I say that is you're here for a reason, things don't work so smoothly for many of you. The detoxification process is not as efficient. The body's ability to detox is not as good. There's a group of people that the exposure to mold overwhelms the body's detox capacity, which leads to the accumulation of mold. Basically, you can't get rid of it, so it starts to accumulate inside. And that accumulation makes the body's immune system respond. Like, what is all this stuff that we have here? And that response is what we call mold-related illness. The toxins and the body's response causes chronic inflammation. And you already know what chronic inflammation can do to your body. It starts with symptoms such as fatigue and feeling off. It can go as far as cognitive impairment, respiratory problems, and so many other debilitating illnesses. So you might say, well, how do you know? What makes these people different? Why are some people okay with mold and some people aren't? Why does mold cause havoc for some people? First, there's a few answers to that. For some, it's the amount of time exposed. So maybe you're in the office for a few months, a year, and it doesn't bother you at all. But over time, after years and years of exposure, the body's ability to detox it kind of fails. For others, it may be that they're just more susceptible. Think of the people who are asthmatic or have another autoimmune issue or chronic issue. Their body's already dealing with something and they're less likely to be able to manage one more thing. Their system's busy and to actually detox one more thing is too much for them. And then there's a group of people who are really genetically designed to not detox mold well. And so this is why you could have 5 people in a family or 10 people in an office. Everyone's exposed to mold for the same amount of time, but the person with a particular gene or particular underlying issue will have a hard time detoxing. This makes it even harder for the sick person to be taken seriously because everyone else in the building is fine. And it's so easy to say, why are you having such a hard time? It's got to be in your head because, yes, I see the mold here, but everyone else is fine and you're not. So it can't be the mold because everyone else is fine. Or you can have a whole family of people Everyone's fine except for one of the people in the family. And so then the conclusion is, you're crazy. It must be in your head. You're not.